our Indigenous peoples. We'd like to pay respects to the First Nation and Métis ancestors of this place and reaffirm our relationship with one another. We commit to move forward in partnership with Indigenous peoples in the spirit of reconciliation. In terms of some virtual session best practices, if you are going to speak, very important to clearly introduce yourself and project your voice so you are heard. Very important to limit the background noise through this session and mute yourself when you're not speaking. Avoid multitasking. If you're going to get the most out of this session, it's best to just sort of put your full attention to it because something may have already been asked or there may be something that's already been mentioned, and it's important just to put your full attention towards this session so that doesn't happen. Please speak clearly and be polite in all your interactions with everyone. And then in terms of the chat box function, it'll be important to use the chat box. That's the main way that we're going to get your guys' questions for this evening. And if you do have a question, put sort of question in capitals before your question so our team are able to most easily pick that up and address your question. And we'll be addressing the questions at the end of the session. Also should note that we will be recording this session so it can be referred to later on, and we'll record it up until this point of the chat, or not the chat, but the question answer period. So I just want to introduce our admissions team. So myself, I'm Trustin Domes. I'm the Director of Admissions for the College of Medicine. We have Cheryl Buchert, she's our admissions coordinator. Carla Millsap is and Krista Rode are both important clerical and support members to the admissions team as well. Our agenda this evening, we're going to do an introduction from both the U of R and U of S Pre-Medicine Club presidents. We will have a short video looking at U of S from the Student Medical Society. I'll give a presentation. We'll have a highlight on the Regina campus by one of my colleagues, Jackie Crochar, and then we'll hear from 5 of our medical students that are training across the province. And then at the end, like I said, we will do the question and answer period. So now I'd like to turn it over to the U of R Pre-Medicine Club President introduction, Sanika Saran. Are you available, Sanika? Sanika, if you're available, are you able to introduce yourself and the Pre-Medicine Society's introduction? Okay, we'll come back to that. Maybe if we're able to have the U of S Pre-Medicine Student Society introduction.
Yeah, hi. Can everyone hear me?
Yes, we can.
All right. Well, first and foremost, I would like to thank Dr. Domes and Cheryl and everyone else at the admissions team for giving me the opportunity to speak to you all today. So my name is Samir Ratnaika. I'm a third year arts and science student, and I'm the president of the UFS Pre-Med Club for the 2020-2021 school year. So one of the questions that we are being asked time and time again is what exactly is the Pre-Med Club? What do you guys do, right? So the UFS Pre-Med Club is a completely student-led group, meaning all of the members, including the executive, and the members at large are all undergrad students or students who are planning or interested in pursuing a career in medicine or a related healthcare field. We are also an event-based club. with the primary goals of these events being providing information related to the application process, providing useful study resources and tips when preparing for the application, namely the MMIs and the MCAT, and networking opportunities with current medical students and other pre-med students. We've been kind of lacking in this front a little bit in the past, but we're trying to get more students involved in the pre-med community here at the University of Saskatchewan. And to name a few events we have organized in the past, so for informative nights, we have done MCAT crash courses, mock MCATs, MMI discussion groups, and mock MMI, which we did in collaboration with MESG. And the networking events that we did include the volunteer information night, the undergrad degree information night.
Oh, that's so embarrassing.
Oh, wait, it's a mute? Yeah.
And PMC Wing Night at the Louis Pub, which was sort of a chance for undergrad students to mingle with a med student, ask questions, meet new friends, that sort of thing. If not the most successful, our most popular event would be the discussion groups, where we did weekly discussion groups led by current medical students. The purpose of this event was to get students to familiarize with the MMI format and also to emulate impromptu critical thinking and formulation of answers and problem solving. This event is currently in the organization phase because we're kind of testing grounds to see how feasible and efficacious it will be, especially through an online format. So please stay tuned for more information on that. This year, we are also partnered with the two of the most popular MCAT prep companies among students, the Princeton Review and Kaplan. And through these partnerships, PMC members have exclusive access to discounts and other medical-related events, seminars, or webinars, so things like that. And we have also worked on extending our online presence on social media. So we have launched an Instagram page, Twitter, and a website is still in the works. So we're hoping to get it online by sometime in term 2. Yeah, so we're also working with current medical students on building a Facebook marketplace where you are able to sell and buy used or secondhand MCAT, Casper, or MMI prep products, textbooks, exam resources, so stuff like that. And yeah, so before I end off here, I'd also like to highlight that we the Pre-Med Club, is not directly associated with the College of Medicine admissions team. So registering for this club does not affect your acceptance application to medical school by any means. Yeah, so that's basically what we have in our bucket list for this year. It really isn't much given the circumstances, but I think it's definitely some exciting stuff. So I would like to invite you to join the club to receive access to our mailing list, Kaplan and TPR discounts, event-related information, and priority when registering for the discussion groups and the mock MMI. And also follow us on Insta, Twitter, and Facebook to receive club-related updates. To become a member, email us at ufs.pmc@usask.ca with your name and NSID attached. Yeah, so that's basically what I have for you guys today. And thank you very much for your time, and have a good rest of the night, guys. Thanks.
Thanks, Samir. And Samir, if you could put that instruction on how to register in the chat box, that would be helpful for anyone who may have missed it. So, excellent. Okay, well, thanks for that kind introduction and information. We don't have Sanika on our list of participants at this point in time, but we're reaching out to her to see if we can get the U of R information on the Pre-Med Club. So stay tuned, but we'll move forward. So now what I'm going to do is we're going to just show a creative video, a nice video from our students at USask here. So just give me a moment. I'm going to have to pivot this just briefly.
are a lot of between two campuses, which is a really good option. We have a small class size. I know 99%, 100% of my classmates get to make these lasting relationships. Again, all together. It's almost like a one-on-one relationship I have with so many of the faculty members. They're just so dedicated to getting to know us, and it really makes me feel supported. We all know the doctors nowadays. It's a really special environment. There's a lot of opportunity to do research here at campus. We get a lot of support from the college and our donors to do research. That's very much encouraged by our college. I think that one thing that we do especially well is indigenous medicine. I've just come to learn more about the different areas that those populations face and how underserved they are. We have a really good ultrasound program that we get exposed into in the first year. So the medicine students that opportunity until later on in the a lot of hands-on experience, not only to learn the anatomy, but to take the ultrasound is really good for strong clinical work and depending on doctors that are really strong clinicians. I've heard this resonated from doctors all across the country that graduates from the U of S have the strongest clinical skills.
Dr. Domes,
Barn.
I don't know if
Yes.
you can hear me over the video, but we can't hear the video. It's very muffled and it's skipping.
A lot of schools will actually
Okay, that's not good. Sorry about that. Did the video didn't come through very well then?
No, it was quite choppy. We couldn't really hear anything. It was very muffled.
Okay. Well, what we'll do, the video is available on YouTube. So what we'll do is I'll have Cheryl put it into the chat box so you're able to view it. Sorry about that. This is the challenge with the limitations, I think, of WebEx when we have almost 200 participants. So sorry about that. But what we're going to do now is go on and do my presentation. So we'll just get that up for you guys. Can you guys see this okay?
I see a blank screen.
Okay, is it coming up now?
Now it is.
Okay. And what are you seeing exactly?
About slide 3 of your presentation. So
Slide 3.
about slide 3 of your presentation, yes.
But what exactly is it?
It's the one with the shape of Saskatchewan with 4 different pictures of the site.
Okay, that's where I want to be. Okay, so important for you guys to know that although the University of Saskatchewan campus is situated in Saskatoon, the College of Medicine is a completely Saskatchewan resource. Okay, so of course a big presence is in Saskatoon, but we also have a large presence in Regina and in distributed sites across the province. Okay, so we cover the south, rural areas, large presence in Regina, Saskatoon, of course, large presence in Prince Albert, and northern communities, Indigenous communities, and remote communities. And we're fortunate in Saskatchewan because the future is bright in Saskatchewan for physicians and for physician recruitment. And we know that certainly that there are a lot of jobs for physicians in Saskatchewan. So when you train here, most likely there is going to be a job for you here when you're done. And our school has a lot to be proud of. We have many important initiatives and unique initiatives that other medical schools don't have. Certainly, we do have things that other schools do have, like an MD PhD program. We have a MD MBA program that you can consider. We have very strong focus on social accountability, including Indigenous health. We have both Switch and Search, which are basically student groups that work with underserviced communities and community health with hands-on. And then we also do a lot of work with global health. We have a global health certificate, which is very unique for a medical school to have. And as was mentioned in the video, which I take it not many of you heard, but our school is also well known for leadership in point-of-care ultrasound. So that, amongst other things, are some of our unique features in our school. Of course, you know, I think the learning environment and the social environment of our school is really key. We are a fairly tight-knit community. Saskatchewan's not a really big province, so everyone sort of knows each other. We get to really know our learners, and the learners get to know the faculty really well. And, you know, because of that, you know, we often do a lot of fun activities. Of course, pre-COVID, these pictures were taken, but just goes to show that medicine, you know, of course, it's busy and there's lots to learn, but there's also a lot of time for fun and community spirit. So in terms of our school, it's a 4-year program. Year 1, all 100 students, that's how many we admit per year, are based in Saskatoon at this point. And in second year, 60% of the class stays in Saskatoon and 40% go to Regina for the second year of the program, which is still within what we call the pre-clerkship phase. In third year, which is the clerkship phase, we have some additional training sites, which include Prince Albert and some of our longitudinal integrated clerkship sites, which are currently located in Melfort, Meadow Lake, and Estevan. So it gives opportunity to sort of spend a full year in those communities and learn more in a rural or distributed center. That being said, even people in the more urban areas can do electives and other clinical experiences in distributed centers as well. In terms of getting into the program, what do you need to apply? Again, this is all in our application document, but just to review, we look at both academic and personal factors. In terms of our academics, the MCAT must be written, and that's the most recent MCAT since 2017. 4-year university degree is required in any discipline, and an academic average of at least 75% in that degree. In terms of our personal factor assessment, this is the first year we've introduced CASPER, which is an online situational judgment test that looks for personal factor assessment. We also do a multiple mini interview, which is a series of 8 to 10 minute stations where we go through different topics. And that's sort of the crux of our personal factor assessment. We also do an academic and non-academic misconduct review along with a check of 3 references. In terms of the MCAT is required, as said. We want it to be written by the application deadline and no earlier for this incoming year of January 2017. We look at just the most recent score, so not your best score, but the most recent score. And at this point in time, there's no minimum MCAT score required to apply. But what we do is we look at the applicant pool and then based on our number of spots for interview, have a cut point based on the MCAT for Saskatchewan residents. In terms of recommended courses for the MCAT, there is a strong science component to it. So we do recommend introductory university courses in biochemistry, chemistry, biology, physics. Biochemistry is on there twice. English, statistics, psychology, and sociology to round out the experience to perform well on the MCAT. In terms of MCAT cutoffs for interview, what we have used here in the last few years is the Canadian mean minus 1 standard deviation as our lowest cut point, because that level sort of indicates that people are still able to do well in our program. Below that, there have been some concerns. So these are the current scores as they are in terms of cut points historically in the last few years, and they've been quite stable. CASPER is a situational judgment test. Like I said, it's administered through ALTIS assessment. The vast majority of medical schools in Canada are using CASPER as one of the tools to assess personal factors. It's like I say, through their system. So you basically go to their website and get the information on it. But the main thing that's assessing are things like collaboration, communication, how you would respond in certain situations based on either a written STEM or a video STEM. It assesses motivation, problem solving, these things that we also want to assess in our applicants. The other thing is a multiple mini interview, and we talked about this a little bit already, but this is really the crux of our personal factor assessment. This is our chance to get to know you. We often will run up to 8 stations where you'll be with 8 different assessors. So each station has its own separate assessor. And in here, we're looking for things, ethics, professionalism, communication skills, collaborative skills, and really all these things you see down here in this little flower, which we call the CanMeds flower. So these are all what we call the competencies that make a physician. Now, of course, as you're entering medical school, we don't expect you to have all these competencies, but having some flavor in these competencies and some sort of aptitude in them is very important in our applicants. And this usually happens in March. It is important, and our committee does look at professionalism very carefully and also academic consistency. So your academic record is assessed, as is your professionalism, and that's why we do assessments of academic and non-academic misconduct from any institution that you have attended in the past, and any sort of interactions with our admissions group, either through electronic means or other communications. If it was unprofessional, that would also be noted. So when we take all those factors together, and this is for Saskatchewan residents, the way we assess the rank for admission, 50% of the mark is based on the MMI performance, 30% on the university academic average, and 20% on MCAT performance. Currently, we have 4 different streams to gain entrance into the College of Medicine. The vast majority of the seats are through the Saskatchewan residency pool. We also have 10 seats reserved for the Indigenous admissions pathway, 6 seats through the Diversity and Social Accountability admissions program, which is an offshoot of the Saskatchewan resident seats. So to be eligible for this program, you have to be a Saskatchewan resident. And then 5 seats are reserved for non-Saskatchewan residents. All of our applicants that are going to gain admission have to be Canadian citizens or permanent residents of Canada. In terms of the definition of Saskatchewan residency, we have sort of 2 pathways for that. One is that you've had to lived in the province for cumulatively 15 years in total, or you've had to live in the province for the last 3 consecutive years prior to admission. And documentation is required to prove such residency requirements. Our college really does value diversity. The more diverse our classes, the more interesting perspectives there are. And of course, as the future physician workforce, it's very important from a social accountability point of view that we have a physician workforce that reflects our society. These are some of the reasons why we have instituted our Indigenous admissions pathway, which basically is there and strives to have an incoming class that has a good representation of Indigenous members, self-declared Indigenous students. And really, over the course of many years, we were one of the first schools in Canada to have such a program. We've had numerous Indigenous physicians and leaders graduate and have really served the college very well in their communities. Currently, we have 36 Indigenous students enrolled in our college. As well as this program, there's also mentorship available, special programming like MMI and MCAT preparation, and other supports. And all of this is coordinated through our Indigenous coordinator, Val Pelche, which some of you may have met. And she's a great resource to gain access to these supports and learn more about the program. There's also a lot of information online. We also have the Diversity and Social Accountability Admissions Program, or what we call DSAP. DSAP is a pathway for up to 6 students to gain admission. And one of the main factors there is socioeconomic barriers. So to gain admission into this program, you have to have a combined average family income over the last 5 years of less than $80,000. And what basically the program does is it asks numerous questions, and you have to supply evidence for each of the questions. And each question that's answered yes augments your admission score. So those with more barriers, certainly we compensate for that in the admission score. And it's a completely separate program. When we look at the application timeline, and this has been stable for numerous years, it all starts around July 1st, where the application or the most recent application document is available online. And that'll have all of our up-to-date policies and procedures that need to be followed for the cycle. Beginning August, our online application portal opens. October 1st at 4 p.m. is our online application due date and time. And that's when it's required to be submitted with payment of the application fee. During that time between October to January or so, we're doing file review and assessing and making decisions on who to invite for interview. Those invitations go out usually in February. And then in March, we do our multiple mini interview. Again, we have further file review and other subcommittee meetings. And then the admissions committee makes the final offer of admission, and applicants find out mid to late May. When you look at the applicant pool, we've had a fairly stable applicant pool, although this year the numbers are up a little bit, as you see. But we usually get around 300 to 350 Saskatchewan residents, and we get anywhere from around 250 to 350 non-Saskatchewan residents applying. Over the last 3 years or so, about 75% of the Saskatchewan resident applicants do go on to interview, so pretty high conversion rate for interview, which is very good. That's what we want to see. And in terms of our applicants that are interviewed, as you see, the vast majority of them are Saskatchewan residents. And again, that's because that's our main group that we're looking to recruit and matriculate to our program. Now, in terms of our accepted students, this gives you an idea over the last 3 years, the demographics. So a fairly even male to female split, slight female predominance, and a wide age distribution. Vast majority of applicants coming in are in the 20 to 24 years, but certainly there is a number that are in their later 20s and beyond as well. And we do certainly encourage people from all walks of life and all backgrounds to apply. We certainly encourage mature students. When we look at the question about geographic distribution, especially in the Saskatchewan resident pool, we do see a fairly even split between those who graduate high school in the north of Saskatchewan. By north, we mean north of Davidson in terms of the population centers, and then south of Davidson. It's about even, although last year there was a little bit of a dip in the South applicants that were accepted. Again, that was just a blip, but nothing statistically significant. And we do certainly try our best to keep this as even as possible. And when you look at the median performance of accepted students on the 2 academic metrics that we look at in terms of average and MCAT, this is the median performance of those that do get accepted. So MCAT performance of around the 75th to 77th percentile overall. and a academic average of, again, median of about 89%. But that being said, it doesn't mean those who have lower academic metrics do not gain acceptance into the program. This is just showing you the statistics of the medians. In terms of site assignment, so if you do get accepted to the program, you have to make a decision on where you want to do the years 2 to 4 of the program. There's more information that you'll get at the time of the MMI about the different sites and what they have to offer. But like I said, 60 of the 100 sites are designated for Saskatoon, year 2 to 4, and 40 are for Regina. The longitudinal integrated clerkship and Prince Albert sites are decided not at the time of admission, but later on. Just wanted to spend a little bit of time to highlight our GEM, the Regina campus. So Regina is a key training site for the College of Medicine. The vast majority of the learning actually occurs within a hospital setting in the Regina General Hospital, where they have an integrated learning center within the hospital. So very easy access to patient care right where you're learning, which is excellent. There's also a world-class simulation center, the Delaware Center, which is also attached to the hospital and provides excellent training opportunities and simulation activities for learners. The hub of activity in Regina, especially for the second year, is the Regina Campus Learning Center, which is a beautiful facility. Students have 24-hour access to it. It has a wide variety of different functions. It has the class, like virtual classroom and classroom setting. Of course, with COVID, this has been not used as much or at all because most of the classes are done virtually now, the lectures, but certainly in the past that was used. There's multiple meeting rooms, breakout rooms, a computer room, access to IT and library resources, locker, study space, student lounge, kitchen. So pretty much everything that you would ask for as a medical student for sure. And the feedback from our Regina students has been extremely positive. Some of the benefits are a lot of proximity, close proximity to staff physicians, a good and strong community feel, more opportunities to get hands-on experience and enhance clinical skills because there's less senior learners above you, so you get more of that one-on-one teaching. And because it's a smaller group and close-knit, mainly within the one hospital setting, learners really get to know each other well and develop strong bonds and support each other throughout the way, so along the way. So now what I was going to do is, I don't know if I'm going to show the Regina video because the other video was so glitchy, but maybe what I will do instead is have Dr. Jackie Crochar, one of the physiatrists from Regina and the chair of the Year 2 program from Regina, to give her take and perspective on the Regina campus experience for students. Jackie, are you able to join? Cheryl, is Jackie on the WebEx right now?
I haven't seen her on the list yet.
Okay. So maybe while we're waiting for that, I do understand that Sanika from the U of R Pre-Med Club is now available. Sanika, would you like to give some information about the U of R Pre-Medicine Club while we're waiting for Dr. Crochar?
Sure.
Awesome.
Yeah, so the Pre-Med Club is there for undergraduate students to provide resources, help prepare for the MCAT, all of that stuff. So we have an email, I'll write it in the chat. It's inquiries@urpremed.com. And you can send us any questions you have and we'll try to assist you. We also have, with COVID right now, some of it isn't going on, but usually In the spring semester, we have mock MCATs, mock MMIs that we coordinate through the U of S, and different stuff like that. Also, you can like our Facebook page, and that's where you can get most of information of stuff that we're doing at any moment. So yeah, if you have any questions, you can email I just sent it in the chat. You can also like our Facebook page and message our Facebook page.
Thanks, Anika. Well, while we're waiting for Dr. Kroshar, maybe I will try to play the video, and if it's a complete and utter fail, we can stop it. But let me just see if we can work on that. So just give me a moment to see if we can load that. Okay, so I'm going to start it, and you guys let me know if it's not working at all right?
Dr. Domes, I don't think it's working. I think there's just too many people on the call for it to buffer correctly.
Dr. Dones, I have no sound.
And so you really gain a lot from each clinical encounter.
Okay, let me see if actually I can run the sound through my thing. Just hold on a sec.
You practice medicine as a student, and you should learn medicine as a student.
The College of Medicine Regina campus is a large and essential medical education and research site for our province, and it's based entirely in the Regina General Hospital. About 40% of our students actually do their MD program in Regina.
There's a bit of a special atmosphere here. I think it's related to the smaller class size of the students we have. We have a really energetic group of faculty who want to work with our students, and it's a broad spectrum of faculty between family physicians and specialists.
What's unique about our Regina campus in the Canadian medical education environment is that students start at the beginning of second year in a hospital setting, and thus have great hands-on experience early on in medical school.
I'm more of an active learner rather than someone who can sit and listen, so I knew that if I came to Regina, I'd really be able to thrive.
It's a very open and excellent learning environment. And so you really gain a lot from each clinical encounter. There's never a time where you don't feel very well supported by the Regina staff.
We practice medicine as a team, so we should learn medicine as a team. And I know that the Regina campus does a lot of work to support interprofessional learning, and that's of huge value to everybody, whether it's the learner, whether it's the public, or whether it's the whole culture of the healthcare team.
The Regina campus has access to a lot of great facilities. The Learning Center itself has a lot of the administrative offices are right in the Learning Center, so it's easily accessible to the students. We have an auditorium and a large classroom for large group learning opportunities. Students also have access to small breakout rooms and clinical rooms for some smaller group learning opportunities. They also have access to the health science libraries, and there's a state-of-the-art sim center right here in the Regina General Hospital.
The simulation here, the program here is excellent in all disciplines, and it just keeps growing. We can develop more scenarios for our students, and I think simulation-based teaching is the way that we are really headed as a nation as well. And I think Regina is in the forefront, really.
I would consider studying in Regina for medicine because it offers a lot of opportunity that isn't found elsewhere, both in Saskatchewan and in Canada in general. It offers a small group learning experience that is unparalleled in other major centers across the country. It offers the ability to research and mentor in ways that you really can't customize as easily elsewhere in Canada. And the third thing is Regina as a city is so beautiful and offers so much to do outside of medicine that it would be a wasted opportunity not to come and experience it.
I feel like in my clerkship, I've really been able to thrive as a medical student. It's reinstilled in me the reason why I want to be a doctor is just being so hands-on and being a critical part of the patient's care plan.
The Regina campus fosters physicians that come back to Regina. And I think that speaks to not only how good their training was, but also how much everybody loved working in Regina. And so they were inspired to come back.
All right, so I think the audio, that time the audio went, but the video didn't. So I think you get a bit of a flavor of some of the benefits of the Regina campus and the excellent opportunities that are there. So at this point in time, is Dr. Kroshar available? Okay. So at this point in time, I'm just going to reload the presentation, and then we will do the introduction to our medical students. So at this point in time, I'd like to invite Shaylin Pillay, second-year medical student from Saskatoon, Iman Abdulhadi, second-year medical student from Regina, Tyra Weiss, third-year medical student from Regina, Corey Ziegler, third year medical student, Regina, and Ami Prefontaine, fourth year medical student based out of Prince Albert, to share with us their path to medicine and sort of how they are finding their medical education at this point as University of Saskatchewan medical students. So we'll put it on over first to Shaylin.
Sure. Dr. Jones, I don't know if you want to stop sharing your screen and then maybe like the face will pop up bigger for the students, or if Aman and Tyrell and Corey and Emmy have theirs off as well. Not sure if you want to do that. I know I can see I'm on there, but so hi everybody. My name is Shaylin. Like Dr. Domes mentioned, I'm a second year medical student here at the Saskatoon campus. Well, currently in my house, yeah, my journey to medicine is probably very similar. Well, almost very similar to a lot of yours. I did a traditional 4-year science undergrad degree from the University of Saskatchewan. I did it in anatomy and cell biology. I applied in the 2019 application cycle. And then started med school there in Saskatoon. Originally, I'm from Regina. I went to high school in Regina and then moved to Saskatoon for my undergrad. That was one of the reasons why I chose to do my medical training in Saskatoon, was I found that I had a base here and I wanted to stay here in Saskatoon. As I entered medical school, I really wanted to be involved and got involved in a bunch of different things. So right now, I am currently the VP External for the SMSS, the Student Medical Society of Saskatchewan. Aman is also on the SMSS, but I'll let her explain what she does. So that takes up a lot of my time. I'm also a president of multiple student groups. I'm involved on campus with a bunch of other medical student initiatives. Yeah, that's about me. Apart from med school, I love to cook, and I like running and going to the gym and things like that. So happy to answer any of your questions that you may have about the application cycle and how things are going.
Great, thank you, Shaylin. Aman, would you like to speak now?
Sure, thank you, Dr. Dones. So hi, everybody. My name is Iman. I am a second year medical student. And unlike Shaylin, I had a atypical path to medicine. I actually ran away from the idea of doing medicine for a very long time. So it took some self-exploration and getting my master's degree to really feel like I wanted to do medicine and I wanted to be in healthcare. So if you are on a non-traditional path, don't give up, don't lose hope. However you get to medicine, whatever your path kind of looks like is your path, and stick to it. So just a little bit about what I did before medicine. I like to tell people that I did my psych degree and then had a quarter life crisis and had to come home and really think about what I wanted to do with my life. I did that at the U of S, and then I did a master's of physical therapy. I applied to medicine twice, actually. I didn't get in. I got waitlisted my first time, and the wait list is kind of rough, but that's okay. Persevere, go through it. It's all right. And then the second time I got in, thankfully, but I deferred my acceptance because I was in the master's program. So the office was really supportive through that, and they helped me through that process. So if you find yourself in the middle of a master's or a PhD and you'd like to defer, that's also an option for you for 1 year. Like Shaylin said, I'm also on the SMSS. I'm VP Regina, so I'm a big proponent of the Regina campus, and I know Ty and Corey will be as well. Yeah, any questions you have, please feel free to ask.
Thanks, Iman. That's great. And again, we'll certainly have all of our medical students available for the question and answer at the end. So if you have any specific questions to ask or a question in general for the students, certainly they'll be more than happy to stick around and answer those. So we'll go on to Tyrell then.
All right. Hi, everyone. So my name is Tyrell. I had, I guess, a pretty typical course of what most of you would go through for getting into medical school. Undergraduate degree in chemistry at the University of Regina, and I applied for entry into the class of 2022, and so that would have been 18. I was also waitlisted, and I fortunate enough to get off the waitlist. So if you guys are waitlisted, don't lose hope. There's always the chance, and a lot of people choose other schools. They get into their homeschool or they defer it for a year. So keep positive for when you guys, if you do get on the wait list, and just don't lose hope. When I got into this school, like a lot of like Shaylin and Eman, I took positions on student committees for our academics. I took a role as the VP Regina, so I'm actually the previous year's VP Regina, and Eman has taken over for me. And this year I'm one of our year 3 class reps. So I've had a lot of good opportunities in the college to work with the UGME and the student body, and they've all just been super supportive and just a great environment to work with. So if you guys do get the opportunity, I'd really recommend the University of Saskatchewan. I'd really recommend the Regina campus. I am biased towards the Regina campus. And yeah, if you guys get the opportunity, get involved when you guys get in, and just good luck.
Okay, thanks, Tyrell. And Corey?
All right. Hey, everyone. My name is Ziegler, and I took a look through the list of everyone on here, and some of you actually I have taught. I was a high school teacher for a long time, and I counted 4 of you at least 4 of you that I've actually taught before. So welcome. It's great to see you again. You 4 would absolutely know that anything but typical has been my journey into medicine. This is actually degree number 5 for me. So I've gone through the ringer a few times, and I'm the old man of the class. I'm the oldest one in our 2022 class. At 43, I guess I am. I'm so old I barely remember my age. But again, would love to talk about the non-traditional route, where if you have a dream and you go for it, it actually is really uncomfortable and it's really tough. And yet at the same time, I'm feeling like it's worth it. I just came off of my obstetrics rotation, and I delivered 36 babies. 36 babies in the last 6 weeks, and it's amazing. It's an amazing experience. And as Ty said, as Aman said, we're big proponents of Regina because of what we get to do. We're just doing more stuff than some of the other locations, including writing prescriptions and things like that other locations just don't get to do. So anyways, non-traditional route is sometimes looked for as somebody who has life experience, or at least that's what I'm hoping that they brought me in, and not just as a circus act. But anyways, it's lovely to be here, and would love to answer any questions.
That's great, Corey. And yeah, as he said, we don't put an age limit on who gets into our college, and we very much appreciate the perspectives that all the members of the class, but the more mature students as well. It just brings for the class a different perspective. Have worked in a different environment. As a previous teacher, you bring some richness to the class in discussions and way of looking at things that is unique and just adds richness. So for sure, we encourage people to apply from all different backgrounds. And do we have Ami available? Cheryl, is Ami? I guess she's not on quite yet. So she is busy. She's a 4th-year student, so I think she was planning to join us, but something may have come up, and hopefully she'll be able to join us here shortly. Do we have Dr. Kroshar at all available? Okay. Well, with that, we will go on, I think, to the question and answer segment of the program. So Cheryl, have you had a chance to collate some of the questions? Because I was seeing through my presentation lots of questions coming up, so I know that there are certainly